Okay, before we begin, I'd like to go over today's assessment and treatment. Based on what you've told me so far, I don't see any contradictions that would prevent us from proceeding today. During the assessment, some of the movements or palpation may temporarily produce or aggravate your symptoms because we're identifying where the dysfunction is coming from. The treatment can also cause some temporary soreness or discomfort afterwards as your body responds, and although uncommon, symptoms can occasionally worsen if the primary dysfunction doesn't respond as expected. In today's treatment, some of the benefits is that it may help determine whether your concern is within my scope of practice as a manual osteopathic therapist, and helps identify the primary source of your symptoms so I can choose the most appropriate treatment. Some people also experience symptoms simply from the assessment and movement itself. In today's session, we will include observation, movement testing, and hands-on palpation, which may involve areas such as pelvis, hips, chest, abdomen, or the gluteal region, if they're relevant to your condition. I'll explain everything before I do it, and your comfort and privacy are important to me. You have the right to ask questions, refuse any part of the assessment or treatment, or stop the session at any time. I can also stop the treatment if it feels that it's not appropriate or safe to you. With your permission, the session will be videotaped for my case study. The recording will be used for educational purposes only and handled confidentially. Do you have any questions?
No.
Do I have your consent to proceed with the assessment, treatment, and recording?
Yes.
Thank you. Okay, now we're going to start the assessment. So I'm going to get you to stand up. Perfect. And I'm just going to look at your posture.
Okay.
Okay. And just stand as naturally as possible. So shake. Okay. And then stand naturally. Feet hip width apart, so a little bit more. Okay.
Like this?
Yeah. Okay. I'm noticing that your left shoulder is elevated. Okay. And I'm just going to get you to quarter turn facing the sliding door. Perfect. Okay. Slight shoulder rotation forward. Looks like slight anterior pelvic tilt. Okay, and then half rotation towards the crazy wall. Okay. Okay, and another half rotation towards the other wall. Thank you. And now I'm just going to get you to walk back and forth a couple of times for me. Just most naturally. Okay.
How many times?
Just a couple more.
Okay.
Okay. And that's good. And then now I'm just going to get you to stand. And I'm just going to get you to drop down on your heels. Any pain or discomfort with that?
No.
No? Okay. So now just standing, I'm going to get you to cross your arms over your chest. And we're just going to side bend only from your trunk. So not turning your hips, you want them completely straight. So you want now side bend. Okay, and straighten. Neutral. Come back to neutral.
Okay.
And then side bend to the other side. Any pain or discomfort? Okay, and go back to this side. Okay, so you have a slight rotation when you're bending to that side. Okay, and now I'm just going to get you to rotate, so turn. Any pain or discomfort?
No.
Okay, and turn to the other side. Pain or discomfort?
No.
Okay. And then I'm just going to get you to bend forward all the way down as far as you can. Pain or discomfort?
No.
No?
Not really.
Okay. And then we're going to do leg and arm circles.
Okay.
So I'm going to get you to do your arm forward in a circle. Okay, and then the other way. Any pain or discomfort?
No.
Okay, and do the other one. And the other way. A little bit of a hinge there. Do it again, that one. Okay, and then go the other way. pain or discomfort?
No.
Okay, and then your legs. So you're gonna do hip circles. So they're gonna be like this. You're gonna go like that, and then like that. Pain or discomfort?
No. It feels good.
Okay, and then the other side. Do that side again. Pain or discomfort?
No.
Okay, thank you. So now we're going to get you up on the table. I'm just going to get you to put your feet here. And we're going to basically do the same things again. So I'm going to get you to cross your arms. I'm going to get you to side bend. And then to your left. Pain or discomfort with that?
No.
And then we're going to rotate. And to the other side. Any pain or discomfort with that? Okay, and then we're going to go into flexion. So you're going to bend forward. Pain or discomfort with that?
No.
Okay. And then we're going to do our cervical, so your neck. So what we're going to do is we're going to do extension. So looking up, pain or discomfort?
No.
Look down, pain or discomfort?
No.
Okay, and then you're going to look over your right shoulder, look over your left shoulder, pain or discomfort?
No.
Okay, and then we're going to side bend. So ear to the shoulder and the other side. But don't raise your shoulders. Okay, any pain or discomfort with that?
No.
Okay, perfect. And I'm just going to get you to lay on your back. And we're just gonna come and I'm just going to do your ribs. So I want you to breathe in and out. And again. Okay. We're just going to do a couple of testing. So I'm just going to test for some dermatome, so sensory. So I'm just going to do your lower extremity, mainly just the hip area since that's where your issue is.
Okay.
So we're going to test for your L1. I'm just actually going to get you to move over right to here.
Still sitting?
Yeah. Okay. That's good. Okay. So L1. Both sides, same or different? Like the feeling?
They feel the same.
Okay. L2. I'll just get you to put your hands here. Same or different?
They feel the same.
Okay. L3. Same or different?
Same.
L4. Same or different?
Same.
All right. And then we're going to do the sweat gland test. So I'm just going to get you to put these underneath your armpits and just hold them there. And we just test to see if your armpits are a little bit sweaty. And perhaps in the meantime, it'll get you to lay down facing up. I'm just
So
gonna,
belly to the sky?
yeah. And I'm just going to do a thermal test. So keep those in there. Just lay like this. So I'm just going to go over. Just see if there's any difference in body temperature anywhere. Okay.
Am I allowed to adjust this because this
Yeah.
one's higher than the other?
Yeah, sure. Okay, and then I'm just gonna check for varicose veins. Here, okay. And then we'll take these out. Good. And I'm just gonna get you to turn over. And then we'll just check for varicose veins on your backside as well. I'm just gonna check here. That's good. Here. Excellent, thank you. So now we're just gonna take your blood pressure.
Okay.
And you do 3 readings, twice on the left and once on the right. So just straighten your arm. Just relax your arm.
My arms might be a little tighter yet.
Okay, so we're just going to take your blood pressure now, and we're going to take it
Okay.
3 times. So the left side, right side, and then the left side again. It might feel a little uncomfortable. Okay. Try not to move around. Okay, how was that?
It was a little tight, but I'm pretty sure it's supposed to be like that.
Yeah. And then I'll just get you to scoot your body the other way.
I don't think this fits me, but it's okay.
Yeah. So, let's do the same here. Just relax your body. Okay. And for the sake of the video, we'll just do 1 on each side. Okay, so now we're going to do some testing, Mitchell's testing. So what I'm going to get you to do is turn to the side here. I'm just going to measure some of your bones. So we're at the ilium, nice and even. Okay, I'm just going to come down here. Okay, your ilium height was good. Your deep sulcus is nice and even. Okay, and just gonna get you to bend forward.
How much?
That's good. Back up. Okay, and then just gonna get you to stand to the side here. I'm just gonna test for posterior and anterior pelvic tilt. So I'm just gonna look for your ASIS and then your ASIS. And just put your arm across your chest for me, just so that, okay. So you definitely have an anterior pelvis tilt. Okay, and I'll just get you to turn to the other side. And I'll do this side. Okay. And again on this side too. All right. Okay. And I'm just going to test your spine here for any rotation. Okay. Looks good. So now I'm just going to get you to slightly flex forward. So like that, just a little bit more. Perfect. Okay, and then I'm just going to get you to extend backwards. So you're just going to look up, a little bit like that. Perfect. Okay, I'm just going to get you seated. We're just going to do that. And we're going to do everything the same as what we just did. So inhale page is good. Just going to find your... Okay. I'm just going to get you to flex forward and put your elbows on your knees. Okay, and then back up. Okay, no up slip there. Okay, and then we're going to do the same with your spine. Just going to feel here. Okay, then I'm just going to get you to flex forward a little, same as before. Okay, and then I'll get you to extend like you did before. Perfect, so look up more, like, yeah, thank you. Okay, thank you. Your spine, for any side bending or rotation. Okay, and then we'll get you to come up onto your elbows. Okay. Okay, and we'll go back down and relax. Okay, so I'm just going to come in and check your sulcus. They're pretty good. Just going to check your sacrum for counter-nutated or nutated. Seems pretty neutral. And I'm just going to have to get you to relax your glutes. And relax. Relax. Okay. And I'm just going to get you to come up onto your elbows. Okay, pretty even. Okay, and you can go back down. Perfect. Just have your legs straight. Okay, and I'm just going to come and feel for your vertebral. Okay, and I'll just get you to put your fingers where mine are. Here. Perfect. I'm just gonna measure for, no, legs straight. Okay, and relax. Okay, and I'll slightly lift your finger up to put it on top of the, okay, and hold it. Okay, and let go. And we'll do the same on this side. Lift your finger up a little. Perfect. So you have a slight inflare on your right side here. Okay, and now we're just going to measure your leg length. So relax. Okay. And the same on this side. If you want. There. Okay, and they're even. Okay, so we're just going to do some passive range of motion. Just get you to put your head in neutral. Okay, so this is completely relaxed. So we're going to do hip flexion. Okay, then the extension. Medial rotation, lateral rotation, abduction. And the favor, so I'm just going to get you to do that. Any pain with that?
A little bit right here.
Okay, so just a bit tight in there. Okay. Okay, and I'm going to do the other side as well. Relax. Okay, slightly tighter on this side. Any pain on this side?
No.
No? Okay, so just on your right, your right side. Okay. And just gonna have you turn and lay on your belly. So we're just gonna do kind of the same thing. So you're just gonna relax.
Okay.
And we're just gonna do the flexion. And we'll do hip extension. Any pain?
No.
Okay. And then any pain here?
No.
Relax as much as you can. Okay. Just gonna do it on the other leg. Any pain or discomfort?
No.
And relax. Any pain?
No.
Pain or discomfort? Going to do one other test before we move forward with treatment, just to see if it's a ligament or muscular dysfunction. I'm going to get you to lay on your back. Okay. And legs straight. And I'm just going to get you to lift your right leg up, straight, and down. You don't need to lift it as high. And then your left. Okay. And down. So now I'm going to compress your hips, and you let me know if it's easier or harder to lift your legs. So, okay, lift again. Easier or harder, or the same?
I think it's the same.
Okay, and your other one? Easier or harder?
Easier.
Okay, but do the right one again. Easier or harder?
Same.
And do your other one.
Same.
Okay. Okay. And then what I'm going to do is I'm going to hold down your shoulder, and you're going to lift this shoulder to this leg as you're raising this leg. Okay. And whoa. And just let me know if it's easier, harder, or the same. And go. You have to lift your shoulder to all in one movement.
Okay.
Ready? Go. Easier or harder? Relax, relax.
Harder.
It's just like a slower movement. So it's just
Oh.
like, okay, so try it again. Okay, and relax. And you don't need to come all the way up, okay? So, and then this side. Other leg, opposite.
Oh, sorry.
That's okay. And relax. Was it easier or harder? Or the same?
Tiny bit harder.
Okay. So I'm just going to do a general treatment here. So I'm just going to circumduct your leg. So be completely relaxed. And then I'm just going to drop your leg 3 times, okay? And relax. Okay. And we'll do the same to this side. Okay. And relax. Okay. Pubic dysfunction correction, since your pubic tubercles were not aligned properly. Okay, so I'm just going to get you to bring your legs up in kind of clamshell, so feet together, and 10% of your effort, I'm going to get you to resist my hand, so push in, 10% less than that, so just slight, okay? We're just going to warm up the tissue, okay? And push out, and in, and out, and in, and out. Okay, and then I'm going to put my arm between your legs, and you're going to squeeze as hard as you can, and then quickly relax, okay? So you're gonna go squeeze, 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 okay? Okay, ready, and go. Squeeze, squeeze, yeah. So when I tell you to relax, okay? So squeeze, 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 relax. And again, squeeze, 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 relax. And again, harder, squeeze, 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 relax, okay? And legs down. Okay. And just your shoulders, okay? So I'm just gonna check your vertical. Okay. And just put your fingers in there. Okay. Let's do a quick measure. And lift up a little bit. Okay. evened out. Spine adjustment. So what I'm gonna do is I'm gonna get you to relax against me. I'm just gonna get you to lift. I'm just gonna come. You're okay?
Yeah.
Okay. Just gonna get you to relax. I'm just gonna gently move. Set up. Okay, and then I'm just gonna get you to come over here and stand up. We're gonna reassess your ASIS and PSIS to see if you
Am I
have
supposed to do that same thing on the other side?
just the one side.
Okay.
So I'm just gonna assess to make sure that if your hips have. Okay. Okay, this side is looking really good. Okay, and I'm just gonna get turned to the other side. Okay. So here. Just gonna get you to raise your leg up, this leg, for me. Okay, and put it back down. Perfect, thanks. Good, you're within a good measurement. I just want to go over what we did. We just corrected your PSIS and ASIS, so your anterior pelvic tilt, and you also had a bit of pubic tubercle was imbalanced. So we did some adjustments and the outcome was really good. So moving forward, some of the home care that you can do are dead bugs, lots of hip flexion stretching, and doing some quad strengthening. So I can send all that information over to you so that you can start doing that within the next couple of days, and it's something that you should do every day.
Okay.
Okay, you might have a little bit of discomfort in the next day or two, but it should be very mild. Do you have any other questions?
No.
No? Okay. And I think that we should set up appointments for weekly for the next couple of weeks and see if we can keep the progression going. Does that sound all right?